Hi, you guys. Welcome back for our daily practice questions. It is day 130. And as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. And before getting to our questions for today, as I was stating on yesterday's video, I've been receiving questions about how to find my resources. If you go to the link in the bio, all of my resources are there. So just go to the main page and click more, and you'll see everything that I offer: review book, ebook, digital flashcards, QBank links. Everything is there. And also, don't forget to hit that subscribe button so you don't miss any notifications of my upcoming videos. Now, question number one for today. Which of the following is an example of secondary prevention? Is it A, administering the HPV vaccine to teens? Is it B, conducting blood pressure screenings at a health fair? Is it C, providing cardiac rehab after an MI? Or is it D, educating about healthy eating in preschool? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the question is the stem is the question, right? So it states, which of the following is an example of secondary prevention? And your best answer is B, conducting blood pressure screenings at a health fair. Remember, secondary is screening. I always say think S and S. S for screening, S for secondary prevention. All right, question number two. Teaching a patient with COPD how to use a home nebulizer is an example of, is it A, primary prevention, B, secondary prevention, C, tertiary prevention, or D, health promotion? Take a moment and tell me what you got in the comments. All right, so again, STEM is the question is the STEM. States teaching a patient with COPD how to use a home nebulizer is an example of, and a C, tertiary prevention. Remember, tertiary is the focus of treatment, right? T for tertiary, T for treatment. We're talking about COPD management and teaching them on that, okay? And then lastly, we have question number three. Which of the following best represents a primary prevention strategy used by a nurse practitioner? Is it A, routine colonoscopy for patients over 50? Is it B, smoking cessation counseling for a patient with COPD? Is it C, administering a flu vaccine at a wellness visit? Or is it D, monitoring an A1C in a patient with type 2 diabetes? Take a moment and tell me what you got, y'all. All right, so STEM is the question. Question is the STEM. It states, which of the following best represents a primary prevention strategy used by nurse practitioners? And your best answer is to administer the flu vaccine at a wellness visit. So C. Remember, primary prevention is those preventative measures, right? So flu vaccine, immunizations, vaccinations are preventative measures. So that's primary prevention. Secondary is screening, tertiary is treatment, okay? So C is your best answer. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. Everything that I do offer is linked in the bio. As I mentioned earlier, And as always, if you're looking to book any of my one on one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.